Imagine waking up tomorrow morning and noticing something you have been trying to ignore for years. You look down at your belly while getting dressed, and instead of the soft stomach you remember from your younger days, there is a firm, stubborn band of fat surrounding your waist, like a belt you never asked for. You feel it every time you bend over. You feel it when you button your pants. You feel it when you walk up the stairs and your breathing becomes slightly heavier than it used to. You tell yourself it is age. You tell yourself it is slowing metabolism. You tell yourself it is part of life after 60. But deep down, something in you knows there is more to the story. You head to the kitchen. You check your fasting glucose like you have many mornings before. The number staring back at you is higher than yesterday, or the same as last week, or just a little worse than it was a few months ago. Not bad enough for medication, maybe, but not good enough to relax. It sits right in that space people call prediabetes, a word that sounds harmless until you realize it is a quiet warning that your body is running on autopilot towards something far more serious. You pour your morning coffee and look at the sugar packet or the artificial sweetener or the flavored creamer you have used for years. You hesitate for a moment. You wonder whether this tiny choice matters. You wonder why your energy crashes every afternoon, why you crave something sweet after dinner, why your belly keeps growing even if you eat less than you used to. You wonder why your doctor tells you to watch your carbs or lose a few pounds, yet nothing you try seems to work the way it should. Let me tell you what I have told thousands of patients during my 40 years as an endocrinologist. After the age of 60, your pancreas stops forgiving your mistakes. In your 20s and 30s, your pancreas could handle the stress of modern food. It could push out extra insulin to keep your blood sugar stable. It could clean up the damage created by breakfast cereals, fruit juices, flavored yogurts, and desserts. But after 60, insulin resistance begins to, your cells stop listening to the insulin your pancreas produces. Your pancreas works harder to compensate. It produces more insulin than your body actually needs. And eventually, the entire system becomes overwhelmed. Most people believe high blood sugar is the root of the problem, but blood sugar is not the cause. Blood sugar is simply the smoke rising from a fire that is burning somewhere deeper inside your metabolism. The real fire is insulin. When insulin stays high for too long, your body enters a metabolic state. Fat burning becomes almost impossible. High insulin locks fat inside your cells. It forces your liver to manufacture more fat. It instructs your body to store energy instead of burning it. You can cut calories. You can exercise. You can skip dessert. Your belly will stay exactly where it is. Your blood sugar will continue climbing, and your energy will keep falling. The hidden truth is that every spike in insulin pushes your body away from health and toward disease. The more often you spike insulin, the harder your pancreas has to work. The harder it works, the quicker it burns out. Most adults do not reach diabetes because of sugar. They reach it because of years of chronic insulin overload. So the question becomes simple. How do you lower insulin without starving yourself, without extreme diets, without complicated programs, and without living in fear of every carbohydrate on your plate? There is a method I have used with patients for decades. It is simple, practical, and incredibly effective for people over 60. It does not require counting calories or cutting out entire food groups. It does not require medication. It does not require supplements. It requires only one change in your daily routine, a change that uses your biology not willpower, to reduce insulin, clean your blood sugar, and help your body burn the fat around your belly. The method is this: eat a small serving of insoluble fiber 30 to 40 minutes before you eat any carbohydrates. That is it. No secret pill, no detox, no special product, just a small serving of raw vegetables before your meal. It can be a handful of leafy greens. It can be a small bowl of salad. It can be a few sticks of celery. It can be a mix of spinach, lettuce, or cabbage. Anything with insoluble fiber will work. Why does this matter so much? Because insoluble fiber slows the absorption of glucose in your digestive tract. It creates a natural barrier that protects your bloodstream from the sharp rise in sugar. Carbohydrates enter your system. When glucose enters slowly, your pancreas does not need to release a large surge of insulin. Your insulin stays lower. Your fat-burning pathways stay active. Your cravings decrease. Your belly fat begins to shrink. Your blood sugar stabilizes. Your energy becomes smoother, and your risk of diabetes drops dramatically. This is not theory. This is physiology. And after 60, physiology is more important than ever. Metabolic error becomes much smaller. Once you understand how this works, you never look at food the same way again. Let me explain what happens inside your body when you eat a small serving of insoluble fiber before consuming carbohydrates. Picture your digestive tract as a long, complicated highway lined with sensors that respond to the food you eat. When you eat carbohydrates on an empty stomach, without any protective fiber, the glucose rushes into your bloodstream, quickly overwhelming your system. Your pancreas senses this surge and panics. It releases a large amount of insulin to force the sugar into your cells as quickly as possible. But after 60, your cells have already begun resisting insulin. So your pancreas has to release even more. This creates a spike. This crash often leads to cravings, fatigue, irritability. Insulin spikes are the silent driver of belly fat. They send a biochemical message to your body that says, store everything, do not burn anything, even if you eat less than you used to, even if you exercise, even if you avoid sugar. High insulin stops fat loss completely. This is why many older adults cannot lose belly fat. No matter what they try, they are not failing. Their physiology is simply working against them. But when you eat insoluble fiber 30 to 40 minutes before your carbohydrates, everything changes. The fiber slows the rate at which glucose enters your bloodstream. Instead of a sharp rise, glucose enters gradually, like a gentle wave rather than a tsunami. Your pancreas does not panic, releases less insulin. Your cells absorb glucose more efficiently. The spike becomes a smooth curve. Your cravings weaken. Your energy stays stable. And most importantly, your body remains in a state where fat burning can continue. This simple routine has helped thousands of my patients lower their insulin levels without medication. It has helped them reduce belly fat, improve energy, sleep better, and stabilize their blood sugar in ways they never thought possible. Some of them had been battling prediabetes for years. Some had tried multiple diets. Some believed their age made improvement impossible, but once they understood how insulin truly works, they realized they were not fighting their age. They were fighting the timing and structure of their meals. The key is consistency. You must follow this routine for 5 or 6 days in a row to give your metabolism the chance to reset its rhythm. Every meal becomes an opportunity to support your pancreas instead of stressing it. Breakfast, lunch, dinner, before every meal containing carbohydrates. Eat that small serving of raw vegetables. You do not need a large bowl. You do not need anything complicated. Even a small handful of greens can create a protective layer of fiber that dramatically changes the way your body processes glucose. Think about what this means for your daily life. Instead of chasing your blood sugar with medication or blaming yourself, your cravings spiral out of control. You create a system that works with your biology. You support your pancreas. You calm your insulin response. You allow your liver to keep up with its workload. You reduce the fat circulating in your bloodstream. You lower inflammation. You give your metabolism a real chance to operate as it should. When my patients began using this method, the first thing they noticed was their afternoon energy. The crash that used to hit them between 2 and 5 in the afternoon began to fade. They no longer needed snacks to make it through the day. Their cravings, they began sleeping better. Their belly fat felt less firm. They woke up with more mental clarity. They felt more balanced. They felt more in control. Many believed something extraordinary was happening, but the truth is much simpler. Their insulin was finally coming down. When insulin comes down, fat burning begins. When fat burning begins, everything else improves. And once they saw results, they wanted to understand why this simple routine worked so powerfully. The explanation lies in how your digestive system communicates. The first 40 minutes after eating are the most important for your insulin response. If glucose hits your bloodstream too quickly, your pancreas has to overcompensate. But if glucose is absorbed slowly because you added insoluble fiber before the meal, your pancreas can relax. It releases just enough insulin to handle the glucose efficiently. This prevents the roller coaster effect that leads to cravings, fatigue, and over time, this routine helps lower your fasting glucose. It helps reduce the stiffness around your belly. It helps your body feel lighter. And the best part is that the results do not come from deprivation. You do not have to give up carbohydrates entirely. You do not have to follow extreme diets. You simply have to support your body with the right sequence of foods. But there is one warning you must understand. Do not combine this method with processed fruit products. That means no smoothies made from blended fruit, no fruit juice, no packaged fruit bars, and no so-called healthy fruit-based desserts. These products contain high amounts of fructose without fiber, which bypasses your digestive protections and slams your liver with sugar. If you mix fructose overload with carbohydrates, your insulin will spike even higher. This cancels out the benefits of the fiber routine and creates more liver stress, more cravings, and more belly fat. Instead, eat whole fruits with intact fiber. If you want something sweet, the fiber in whole fruits slows the absorption of fructose and prevents the liver from being overwhelmed. But avoid smoothies and juices entirely. Your goal is to lower insulin and clean your blood sugar. The final piece of this routine is awareness. Pay attention to how you feel after meals when you use this method. Notice your energy, notice your cravings, notice your mood, notice your belly. Your body will tell you immediately whether your insulin is calming down. The signs will be subtle at first, but they will grow stronger each day you follow the routine. By the fifth or sixth day of following this simple routine, most people begin to experience a shift that feels almost surprising. Their blood sugar begins to stabilize in the morning. The number on the glucose meter no longer jumps unpredictably. Their belly begins to feel less firm. The pressure under the ribs becomes lighter, Their cravings for bread, sweets, or late-night snacks begin to fade. Their energy throughout the day becomes more even without the highs and lows that used to control their mood. They begin waking up feeling refreshed instead of weighed down. This is not magic. This is not luck. This is physiology behaving exactly as it should once insulin begins to calm down. When insulin comes down, your cells regain their sensitivity. Your muscles begin using glucose more effectively. Your liver stops being overloaded by constant signals to store fat. The fat already stored inside your liver cells begins to decrease. The visceral fat around your organs begins to shrink. Your metabolism stops fighting against you, begins working in your favor. By the end of the first week, many people notice their belt fitting differently. They notice that the tightness around the waist begins to loosen. They notice that their afternoons slump. They notice they no longer feel the urge to grab something sweet after dinner. This is because the biochemical storm caused by chronic insulin spikes is finally beginning to settle. What makes this routine so powerful is that it does not rely on dramatic restriction. People do not fail because they lack discipline. They fail because their physiology has been working against them. Once you restore proper insulin signaling, your body naturally becomes better at burning fat, better at controlling blood sugar, and better at regulating hunger. When my patients follow this method consistently, their fasting glucose begins to drop within 1 to 2 weeks. Their hemoglobin A1C begins improving within a couple of months. Their triglycerides often drop as the liver stops producing excess fat. Their mood stabilizes because their energy is no longer crashing throughout the day. Their mental clarity improves as inflammation decreases. They begin to feel like themselves again. The beauty of this approach is in its simplicity. You do not need to become, you do not need to count calories. You do not need to avoid carbohydrates. You do not need medications unless your doctor requires them for other conditions. You only need to follow the natural order that your physiology prefers: fiber first, carbohydrates second, protein third. This sequence creates a metabolic environment. Insulin does not spike aggressively. It gives your pancreas the break it urgently needs after 60. It gives your muscles and liver the stability they require to process glucose without drowning in it. Let me give you an image that might help. Think of your pancreas as a tired worker who has been covering extra shifts for decades. Every time you eat carbohydrates without any preparation, you force that worker to run at full speed. After 60, that worker no longer recovers between shifts. It needs help. Insoluble fiber is that help. It slows things down. It gives the worker time to breathe. It makes the job manageable. Again, it turns chaos into order. Now imagine what would happen if you gave your pancreas that support at every meal for a week. Imagine what would happen if you removed fruit juices and smoothies during that time. Imagine what would happen if you kept that routine going for a month. You would watch your blood sugar clean itself. You would watch your belly shrink little by little. You would watch your cravings lose their power. You would watch your body transform, not through force, but through wisdom. Your body still knows how to heal. It has not forgotten what health feels like. It has simply been overwhelmed for far too long by foods that push insulin into dangerous territory. But once those foods lose their grip, your metabolism reawakens, your cells respond, your pancreas rests, your liver begins repairing itself, and your future becomes clearer. So here is what I want you to remember. You are not too old. You are not too old to reduce your belly fat. You are not too old to lower your blood sugar. You are not too old to feel stable, steady, and energized again. Age is not the enemy. Insulin overload is start with one simple step. Today, before your next meal that contains carbohydrates, eat a small serving, give yourself 30 to 40 minutes. Let the fiber prepare your body. Let it toll the absorption. Let it soften the glucose wave. Let your pancreas breathe. Let your liver relax. Let your insulin remain calm. Do this for 5 or 6 days in a row. Pay attention to how your body responds. Notice the softness in your belly. Notice the calmer energy. Notice the lighter morning feeling. Notice the confidence returning to you as the numbers on your glucose meter begin to shift in the right direction. Your body is not broken. It is simply waiting for you to support it in the way it has always needed, waiting for you to understand how insulin truly works, waiting for you to free it from the daily assault of sugars, juices, snacks, and unchecked carbohydrates, waiting for you to use the wisdom of fiber to restore balance. You deserve a metabolism that works with you, not against you. You deserve mornings that feel clear instead of foggy. You deserve afternoons without cravings. You deserve evenings without guilt or frustration. You deserve a body that reflects the care you are willing to give it. It begins with something small, something simple, something your body recognizes instantly. A handful of insoluble fiber before your meal. A pause that tells your pancreas you are safe. Do this today and tomorrow and the day after that. And let your body show you what is still possible